The World Health Organization, WHO, estimates that more than 13 million deaths around the world each year are due to avoidable environmental causes. On this year's observance of World Health Day, the attention is on urgent actions needed to keep humans and the planet healthy. This year's theme is Our Planet, Our Health. Issues on climate crisis, which health experts say is the single biggest health threat facing humanity, as well as the COVID-19 pandemic, are highlighted in this year's observance. Joining me to discuss the theme and how it affects lives are team lead, COVID-19 response team, Lagos University Teaching Hospital, Dr. Iorhen Akase, and a pharmacist, Dr. Christopher Abhulimhen. Thank you very much, doctors, for joining me on NC Continental Prime. I'll start with you, Dr. Akase. Let's take a look at this year's theme, Our Planet, Our Health. What's the connection between these two elements as the world observes Health Day?
Okay, thank you very much for having me here. This theme is very relevant because of recent we've seen a lot of emerging and re-emerging infections and non-infectious diseases that have been, really tested to and change. So in terms of, so really, it's very, very logical, to look at this in terms of how this affects global health, as a whole. Yeah.
Okay. Can you also speak on that quickly, Dr. Christopher? The essence of the theme for the year.
All right. If you look at the theme for this year, Our Planet, Our, the truth is that we're not giving enough attention to the planet that it deserves, which is unfortunate because we put our planet in great danger. And here is what 24% of all global deaths are linked to the environment. You can see from the data statistics that 13 million deaths per year are caused by climate change crisis, and it's something that is very, very serious. If you look at the effect of environmental pollution, it has reached terrifying levels, but we haven't realized it yet. Now look at a country like Nigeria, where some people say it's the poverty capital of the world, where you have a lot of people that are living below the average line, and some are living in slums and trenches. What they are really concerned about is managing the environment at that point in time. They're just concerned about surviving for the next meal. And if you're thinking about protecting the environment, our world is to be a collective effort, and everybody has to weigh in. So we also have to look at it from the aspect of how we have a collaborative approach to protecting our.
Staying with you, Dr. Christopher, plastic pollution is now a menace in our world, and it has made its way into our food chain. What's the way out, and how can the pharma industry help?
I think one of the few approaches that we can use in this industry is we need to go bigger on recycling, and we need to, the government also needs to come in and enforce policies that will protect. And again, environmental pollution, better waste management system. I know that the waste management authority in Lagos is already doing a whole lot. We need to still do more, and the pharmaceutical industry also has to put its weight behind it too. It's a serious issue because if we're having plastic at the deepest part of the ocean floor, that means we really, really need to look into it, and everybody has to weigh in.
Dr. Akase, what are the critical public health situations we are faced with, especially in Africa right now?
Okay, so of course, Africa as a country still has challenges with infectious diseases generally. Of course, we're happy that HIV is on a downward trend. We had a fair share of COVID-19 for the past 2 years. But at the moment, we have infectious diseases like tuberculosis, which is still a problem. Not just drug sensitive, but now having also incidents of drug-resistant tuberculosis. So clearly, this is a problem. We're also having outbreaks of things like Lassa fever, with measles, with cholera. So infectious diseases are still public health problems in the country. But additionally, and I think this is something that we do need to address it, is a concept of the epidemiology transition that's already occurred. Now we're having public health proportions of things like diabetes, of cardiac diseases, hypertension, obesity, alcohol and tobacco abuse, and so on and so forth. All these are things that have markedly impacted on the life expectancy of Nigerians. I mean, years ago, when we about 10, 20 years ago, when we were in early medical school and all that, they would tell you that hypertension wasn't that common. In the 40s, 50s, in fact, there were papers that showed that hypertension was not a big problem in Africa. Yet now we have such a huge population of hypertensives and diabetic patients, and it's clear that non-infectious, or it's called non-communicable diseases, which are NCDs, are clearly problems that are evolving, partly because of lifestyle modifications with dieting and urbanization and so on and so forth, but also some of the stressors that are associated with living in some of our African cities like Lagos, traffic, and so on and so forth. So clearly, it's important for public health institutions to pay attention to not just infectious, which clearly are a problem in Africa, but now non-communicable diseases, which clearly again are on the ascendancy in most African states.
All right, just to wrap things up quickly, I'm going to split the remaining time between the two of you, 30 seconds each. I'll start with you, Dr. Akase. Clean air, clean water, uncontaminated food. One wonders, are these really achievable?
They are, and we should strive, to achieve this, because without these three, clearly, there's so much risk associated with contamination, and we have to strive for that, because clearly, like we mentioned about non-communicable diseases, cancers, and so on and so forth. Clearly, these are things that without, clean air, clean water, and clean food, clearly we will not be able to, achieve this target. Yeah.
I will just have to leave it there for now. Thank you very much, gentlemen, Dr. Akase and Dr. Abhulimhen. Thank you very much for speaking with us.